Hi everyone, it's Kristen. I just figured I'd make a really quick video this morning. I just recently had my 2-year post-op cranianniversary, May 20th, so I figured I'd just do a quick little video, say hi. I'm getting ready for work this morning and I know I'm a hot mess, but whatever. I'm trying to play with my dog here. Okay, so just a quick update on how I'm doing, how I'm looking and everything. And yeah, just keep you updated. So I know I said it in my last video, but I've gotten some Botox on this side. Last time I got it was in March, so I think it's definitely worn off by now. I did a tiny little bit of lip injections, but my reaction was so bad. Like, it was bruised so badly. And I don't know if I just didn't ice it enough, but the point was to kind of like fill more on actually this side. Because when I smile, it gets really thin. But I think that, like, I'm okay with that. I don't want to have these crazy reactions and bruises, and it's like way too much money for what, you know, the little tiny difference that I can't hardly even tell. So whatever. I'm like trying to not be late to work because I usually am every day, but that's okay. So I just want to show you my progress. So I'll just go through a few different facial exercises quick so you can see. Okay. Smiling, showing my teeth. Still not quite there, but I am showing a little bit more, so that's good. A little bit more teeth. Raising my eyebrows, lower, which, okay, what's really weird is when I do smile, you can kind of see how like this eyebrow moves. But when I try to make it move, like when I do that, it's still not working. And the weird thing is when I do practice, like when I do like my own physical therapy at home and try to like raise and everything, I get really terrible headaches, like usually the next morning. Like I can even feel like a slight pain right now, which could very well just be the nerve, but it's really uncomfortable, so I don't really like doing it that much, but I probably should. So there's that. I've noticed, I know I mentioned in one of my videos, like when I like swish water around in my mouth, or like when I use mouthwash, it's really hard to like get it to like not leak out of this side. I feel like that's gotten a tiny bit better, and I almost don't know if that was because of the lip injection. I feel like there's like a little bit more there. So more to come on that, I guess we'll see. I did have an MRI a couple weeks ago. Everything was clear, which is good. He said that there's a tiny bit of like metal in there, probably from when they were, you know, cutting me open. So it's just like a tiny little speck that was picked up on the MRI, so nothing to worry about there, he said. And that basically the branch here and the branch here of the facial nerve are the longest, so it will take the longest to grow back. So I don't know how, I mean, I'm already 2 years out. I really even wonder if it's ever going to come back, so we'll see about that. And as you can see, my eyelid weight is just, you can see it. I don't know, I think like eventually if I can get it removed, I probably will, because I feel like it makes me look like, stop biscuit. I feel like, I don't know, it just makes me look like I'm sick or something, like my eyes are like puffy and I have allergies or something. So I think eventually I would like to have that removed. So we'll see about that. And it was weird because last night I had a dream about my neurosurgeon that like I went to visit for a follow-up, and he showed me like a video that he took of me when like before everything, before my surgery. And I remember thinking like, wow, at the time I thought I looked so terrible. And then like when he played it back to me, I was like, I really like didn't look that bad at all. It was like after the surgery when the full facial paralysis set in, you know, with the nerve graft, that was the hardest part, you know? I don't know, it was just like a weird dream and a weird thing to think about, how badly I felt about the way that I looked before. And then it was like when I was going through it and healing, I really like, I guess because I had felt so bad already, it was almost like, okay, this is nothing, it's fine, and you know, it'll heal. And I think so, like that's kind of what helped me get through and like not really care what other people think. But now like here I am on the other side, and I've mentioned it before, and I like tell my friends that it's like, since things are constantly changing and like the way that I look is constantly changing, I feel like I'm always having to readjust, and that's almost harder in a way. I don't know why. For me it is. Just like adjusting to the changes constantly. So that's kind of like what I struggle with. Like, I don't know. I just feel like week by week I don't always look the same. Which is a good thing, I know, and it's silly. But it's like, now I have to like get used to this again, you know? So I don't know if that makes any sense, but hopefully it does. Well, I'm gonna have to leave for work soon, so I'm gonna finish getting ready, take my dog for a walk because he's staring at me. So wishing you all the best, and I hope this video helped. I just want to recap that I did have a sural nerve graft, so that's what the progress is that we're tracking, and I had a hemangioma tumor. So yeah, I think my Instagram is linked in the description or in the title somewhere, so if you want to check out some of my photos, my progress photos, you can do it on there too. And if you have any questions or anything, my email I think is linked there, or you can message me directly. I'd be happy to answer any questions that you have, and I hope that you found this helpful and that it gives you a little bit of hope that you can progress. It'll just take time. So hope everyone has a good day. Okay, bye.